Goshen Health is a smaller community hospital. We're licensed for 150 beds. Our average daily census is around 60 to 70 patients, and a big footprint in our county that actually services 4 different counties in northern Indiana. And we have approximately 30 physician practices that we provide interpreter services. Lots of people working on schedules to try to fit as many people's availability into the scheduling needs that we had. And we used a very antiquated program to do that, a combination of email and another program that was really set up to be a help desk function. What was our fill rate? What was our demand rate? I mean, you really couldn't get hardly any actionable data out of it. 3 years ago, we did contract with another service for VRI, and it was great from the perspective of adding that leg. However, that service didn't offer any kind of scheduling process, and so we were still stuck with what we had been trying to utilize before. Customer service with that service was absolutely non-existent. I got nothing except for a bill every month that was very expensive.
Presently, we use the VRI, OPI on our video devices. So at any time, 24 hours a day, if someone needs an interpreter, we have devices distributed across the system. All of the different places where patients are seen have devices that they can grab and are within a minute or less, they are talking with an interpreter, and that service is excellent. We've had a great response from our colleagues in how that is so helpful. The other big part of what we use is the Interpret Manager software, and that has really been kind of the thing that has pulled it all together for us. That software is the meeting place where everything can show up in one place on my screen on my computer, and I can get the information I need immediately, whether it's from our OPI or an interpreter or our in-house interpreters, scheduling, all of that. That has really, I can't even describe how that has changed how we are doing our work here, and we have become so much more efficient. We have so much more information about how we're using interpreters and interpreter services.
Prior to utilizing the integrated system with Interpret Manager, our schedulers were texting our interpreters saying, go here, go there. They would be dependent on their Outlook calendar, that kind of thing. It was really disjointed. And with Interpret Manager, they have an app on their phone that they're able to engage with. And so everybody's utilizing the same information. And so it just makes it a little more seamless for them.
It used to take us pretty much a full week, either myself or another scheduler working 8 to 4, for a full week, Monday through Friday, to do the following week's scheduling. And now it probably takes us 2 days instead of 5, honestly.
We have, over 100 devices out there in all different places, and all of these offices and services needed to know what was going on, and so it was really, really helpful that the Boostlingo team joined us in making that plan, first of all, and then the rollout itself. Once we got to day one, they were right with us.
In 1 year, we have cut off our bottom line $250,000. That's huge. It's huge. Coordination of care. That's really important for our patients because, our goal is to care for our community. That's our goal. And they have to be able to hear their health information in the language that they best understand. And without an interpretive services or very robust interpretive services, we're not able to deliver on that mission. And so having Boost as a partner allows us to deliver on that mission.